And welcome to Healthcare Sucks. Hey, this is the crusty edition, so you gotta bear with me, guys. I'm doing what I can. I'm gonna be okay. Just pray for me, and please go out and get prepared. I want to. This is a video that you need to watch and you need to share. This is mainstream. This is not like some goofball thing, and I want to lead into this. That I'm gonna go back to the start so you know who this guy is. That this is a trusted professor. Let's listen and watch what he has to say, guys. That's all I'm going to say to start with because it's very important.
I still have parents that tell me, oh, we're going to our kids' swim meet in 3 weeks. Well, guess what? We're about to experience the greatest pandemic of the generation since polio. Get prepared. We've got to raise awareness, and that's what I'm concerned about. We still don't have awareness out there.
Mayor de Blasio, New York City, declaring a state of emergency this evening, saying, quote, we're getting into a situation where the only analogy is war, saying he foresees a situation where, among other things, hospitals are setting up tents in parking lots to deal with the patients that we might find. It's come to that.
Look, I think every household, regardless of what politicians and government leaders say, every household should declare a state of emergency, get 3 months of food and necessary medications, whatever essential meds somebody might be on, and get ready to hunker down. Look, we're going to see probably over 1,000 deaths per day during the peak of this thing. That's not something we're prepared for. We still have folks who are required to show up for work. We need contingency plans. We need restaurants to move into the delivery business so they can focus on staying alive and supporting people. We need to take care of our own. We're Americans. We need to visit our seniors and leave food for them and call our seniors. So look, we still have schools open around the country. We still have people in denial. We need to raise awareness in the absence of other people not doing so.
Sir, there are suggestions that some of the administration are the ones who are in denial, namely the vice president who's been leading this effort, who continues to suggest, now he hasn't done it today, but saying that the risk of contracting this virus for the average American is relatively low. I hear you telling me this evening that I need to stock up on 3 months of food. Why the difference?
Well, look, again, our government leaders have relied entirely on our Center for Infectious Diseases, which is Dr. Anthony Fauci. And on every network, the media talks about how he is America's doctor. It was in the congressional hearing. But when he was asked how many people have the infection, he said, we don't know. Well, guess what? Probably 250,000 to 500,000 people have it. Probably it is ubiquitous, and this idea of it being contained is an idea we need to abandon. We need to do some dramatic measures, probably similar to what we're seeing in Italy and other countries. We need to get ready to shut down a lot of customer-facing businesses in the United States, and I don't say that lightly. Look, I don't like it. I want to see the NCAA basketball tournament, but we've got to hunker down, and the good news is, in 3 months, this thing will be over. Historically, we know pandemics take 3 months. That was the Spanish flu in 1918. That was the SARS epidemic. We will be beyond this come June or early summer. So we've got to take temporary but yet severe measures to take care of our nation's most vulnerables, those with organ transplants, seniors, those with immunodeficiencies, those with disabilities. We've got to take care of each other and take this seriously.
We need to test people. That seems to be the issue. I'm looking at a graph right now that says we lag so far behind other countries in testing. It's a disgrace. Bahrain, South Korea, Italy, Austria, the United Kingdom, and Japan are all testing more people than we are.
Well, I think the CDC at this point would agree with you. And I've seen these recognitions of the massive missteps in the testing rollout. Look, we thought we had a better testing unit in the United States. It turns out it wasn't true. People who need to get tested quickly without the big bureaucracy of the state public health departments controlling this. There's supposed to be 4 million tests that are about to be deployed. I know they recognize this mistake and they're trying to do everything possible. But honestly, Scott, a test does not change how we treat a patient. We treat them the same. It does not change our management. It is important for tracing and for containment, but at this point, the virus is out there. Assume it's everywhere. Assume it's on every doorknob and every handle and every Uber car handle, and protect yourselves by using things like alcohol, Purell, some barrier when you open something, and minimize your contact and stop all non-essential activities.
Okay, let's start with this. 1 second. Alcohol, remember this, guys? But to be used for, remember where we see this, Team 99? Team 99. That was kind of cute. Team 99. That was almost like a Cat in the Hat moment, if you've ever watched that. Excuse me, I'm getting better, guys. So don't this gloom and doom report has nothing to do with me. This has to do with you guys, and I'm gonna heed the warning, honestly. But we've all been talking about this. If you've watched the last couple minutes of this, there's about another 3 minutes at the beginning. I'm gonna go back and let you watch that so that you get the whole coverage. There's not a lot to add to this, honestly, guys. Either the bottom line is it's being Team 99 and following me, healthcare sucks, and being part of the team. You know what's coming. This guy laid it out, and this guy is a doctor, a professor. This is no joke. You're going to hear all kinds of things about this guy if you go and research. You know, he wrote a book, and he did this, and he did that, but he's credible is the word I guess I would use. And what he's saying is exactly what is not being told to us. They're tamping it down again, trying to save the stock market and whatever have you. The president, this is one of his major mistakes. I love the government as far as them trying to do what's right for us. I don't like the government when they lie to us and treat us like imbeciles and pieces of garbage. And unfortunately, we're being treated like garbage. And he addresses everything we've been addressing, guys. How dangerous it is for the most, the homeless. I don't know if he said the homeless, but I'm going to address that. The people that have had surgeries, the people that have chronic illnesses. You know what? Most people are just fragile nowadays. Let's face it. Even if you go to a gym and you work out, most likely you don't have no endurance. I mean, a lot of people that go to a gym, believe it or not, this old guy can go out here and do work hand in hand with that person, and within an hour that person's heaving and and you just can't handle it. And I can keep pushing with somebody half my age usually. I mean, so excuse me, that thing. So just check this out. That's all I'm saying. Share it. I'll be back to you later today to show you some more stuff. But it's getting to that time. We actually have family that's in Denver, Colorado that's considering coming up to stay with me. Some little grandbabies and stuff, and my ex-wife's daughter and husband, and some other family that's in the area and around. So we're considering, as this moves forward, before it gets to be too late, making camp. And it's going to be camp healthcare, more or less. That's the easiest way to say it, is there's going to come a time when, if you can all get along, I mean, it's going to be hard. There's different age groups, different things. But we're working on maybe doing this if push comes to shove. Because I'm not going to sacrifice my family. I'm not going to sacrifice my neighbors and my friends. I'm not going to sacrifice Team 99, you guys, because I love you. I'm going to help you get prepared. I'm going to really get on it in between fixing my roof. And I have an old spruce in my backyard. On top of everything else, we had about a 400-pound branch come down. Luckily, knock on wood, the Lord parried it over to the side. If it would hit my trailer, it would have been toast. But that's what happens when you have Old Spruce in the back. Old Spruce is awesome. She gives us warmth. She gives us shade. There's a little risk to her. She's old. She's several hundred years old. She's wide around at the base, is bigger than probably two VWs parked side by side. Imagine that VW Bugs. She's almost that width, literally. I'll show you pictures someday. So back to the point. Watch the film. You make the decision. Let me know how you feel. We're going to get back to it. And then I'll let you go. I'm going to make this quick because I want it to download. I don't want this to take all day for you guys to get the picture of what...
The playbook is doing a...
Dr. Marty McCary of the Johns Hopkins Bloomberg Public School.
Dr. Marty McCary of the Bloomberg School something. I'll rewind it again for you guys because I want you to
School
hear
of Public Health is with us live tonight.
School of Public
from
Health.
Washington. Doctor, it's good to have you with us.
Good to be with you, Scott.
Should this have been done earlier, all of this?
Yeah, look, we're way behind.
Dr. Marty McCary of the Johns Hopkins Bloomberg Public School of Public Health is with us live tonight from Washington. Doctor, it's good to have you with us.
Good to be with you, Scott.
Should this have been done earlier, all of this?
Yeah, look, we're way behind the eight ball.
Dr. Marty McCary of the Johns Hopkins Bloomberg Public School of Public Health is with us live tonight from Washington. Doctor, it's good to have you with us.
Good to be with you, Scott.
Should this have been done earlier, all of this?
Yeah, look, we're way behind the eight ball. The signs were out there for 3 months. We've been watching what's happening in China. My team has been talking to doctors in China and more recently Italy. Look, this virus is following the playbook. It's doing exactly what was predicted. The study out of Harvard 3 weeks ago said that 40 to 70% of the U.S. population could get infected. And yet many of us were seen as alarmists and talking, too much of this thing. What is the danger in having a public that's over-prepared and we look back and say it wasn't quite as bad as the projections? This is a playbook that we are watching in Italy. China's not been transparent and Iran has not been transparent, but Italy has been totally transparent. Look at the numbers there. It's probably the best indicator in terms of case fatalities. Look at their hospitals that are overrun in Basica and Lombardy, and you will see what will play out in the United States unless there's some miracle.
Dr. Fauci today said, quote, "It's a failing. Let's admit it." There's another comment tonight from the director of Harvard Global Health Institute who said, and I quote, "This is an unmitigated disaster that the administration has brought upon the population, and I do not say this lightly. We have had a much worse response than Iran, than Italy, than China, and South Korea." Do you agree?
Well, look, the blame game is going around, but I think the administration and the CDC has been pretty honest that they had a massive mistake with the testing and the rollout of the testing, and they are doing everything they can. They've owned the mistake. We've got to move forward. But to be honest with you, what has Dr. Anthony Fauci been saying? He has been giving the most generic and vague recommendations.
Dr. Fauci, that squiggly guy, in case you've been watching my movies. Squiggly guy. While he does give us a little bit, don't kid yourself. He's like feeding us what he thinks like little babies we should be known. And then sometimes he crosses the line so he looks like a hero because it looks like he's telling more than he should. But I'm not here to judge today, guys. Let's leave the judging for the Lord and let's just move together as a team. Again, we're all in this. It no longer matters red or blue or whatever. This is the crisis that we've all... I should probably get on the mic. This is the crisis we've all prepared for, guys. It's no joke. If you think, little old healthcare sucks, go to BP, Earthwatch. He's... As street creds, BP Earthwatch has got more credibility than I'll ever have. But I've learned from the best. I'm going to tell you that. Plus, I'm no spring chicken. I've been doing healthcare for over half my life. So with that, let's watch the rest of this.
Completely absent from what he has been saying on every network, and he's the doc that every network has on, has been no preparation details, no specifics. What about closing our schools? What about contingency plans for public events? What about what businesses do? What about an employee that doesn't feel comfortable coming into her job as a cashier? These are the specifics where we need specific plans and we need to do something. And it's been many of us in public health that have been running around talking. Heck, I had to directly reach out to the mayor of Austin to beg him to cancel by Southwest. I talked to the NCAA. We're out there telling people to get prepared. And why are we not hearing this from Anthony Fauci?
The president, you think the president's been honest about the testing? March 10th, according to my notes, quote, "The U.S. has done a great job on testing. It's really working out." Is that true?
Look, the president is not a virologist and didn't go to medical school. He's relying on our Center for Infectious Diseases, which is led by Dr. Anthony Fauci. The CDC messed up the initial test, and they've owned that. Let's move on. And right now, I still have parents that tell me, oh, we're going to our kids' swim meet in 3 weeks. Well, guess what? We're about to experience the greatest pandemic of the generation since polio. Get prepared. We've got to raise awareness, and that's what I'm concerned about. We still don't have awareness out there.
Mayor de Blasio, New York City, declaring a state.
Okay, so we're back to the part where we started. Again, I employ, but that's all, folks. I encourage you to pay attention to this, spread it, watch it with your loved ones, share it with your loved ones, share it with your neighbors, share it with your enemies. Literally. I do mean that, man, because your enemies aren't really your enemies unless they're your enemies. If that makes any sense. You know what I'm saying? People you just have arguments with, they're not your enemies. Not nowadays. And even if they call you an idiot or dumb or whatever, those people are starting to come around. And pull your pants down, let them kiss your butt. Honestly, because, the kissing of the butt time has come. And I don't mean that. You got to remember who I am. I don't mean that that's what I want people to do, and I don't give a damn if people say, you were call me names at the beginning and now say, you're right. It's not about being right and wrong. It's about saving lives now. So, again, Team 99, guys. Let's try to... This is the opportunity to where we can come together. We were like this. Now we can come together on this, and we can move forward. And then we can argue later after this is done. But honestly, we're looking at a year. I'm just going to call it a year from now. If we're lucky, 6 months from now, start to see some changes. And again, one more time, the only reason there's changes in China is because they do have the vaccination. They have an antiviral. I'm not throwing this at you as some BS. I'm just not, guys. There's no sick China military. The factory cities are up and running and pumping out who knows what. Whether it's things for war, whether it's things for medicine and supplies. We know they're doing that. I can't prove it to you, but I know from my connections. I've got some really deep connections. And then I brought to you the things we can put online with Pastor Paul, Michael Council of Time, and that kind of stuff we can release to you. But there's certain connections that if I was to say who and what, they would get in trouble because of clearances. So with that, I love you. Please watch. Please decide what you want to do. Keep in touch with me. I'll keep in touch with you. I'll pray for you. You pray for me. Team 99. You're awesome, man. We're going to make it together. And sorry for crustage. I'm going to get out there and fix the roof today. And do some other things. And we're going to be okay. Amen. I'm out. And healthcare sucks.